the recent wave of Republican-led bans attempting to block transgender minors from accessing gender-affirming medical care may be fertile political ground for conservatives in an election year, but a new study shows the bans are putting tens of thousands of vulnerable young people in jeopardy. A report from the Williams Institute at UCLA School of Law estimates that more than 54,000 transitioning transgender youth ages 13 through 17 are at risk of losing access to gender-affirming medical care, even in cases where doctors, therapists and parents concur with the need for those treatments. And in at least 3 states, Alabama, North Carolina and Oklahoma, lawmakers are pushing legislation that would impact about 18 to 20-year-olds. The figures are staggering considering that only about 150,000 American youth identify as transgender. According to the Institute, which tracks such legislation, as of Friday a total of 15 states have enacted or are considering laws that would restrict access to gender-affirming care. That includes bills meant to deny access to hormone therapy and puberty blockers, the latter of which are given to transgender teens and preteens to delay the onset of puberty. Both are treatments that have been vetted and peer-reviewed by mainstream medical organizations. In each of these states, the bills would either criminalize healthcare providers who provide gender-affirming care to minors or subject them to discipline from state licensing boards, the report stat. About half of those bills seek to restrict gender-affirming care by banning some insurance providers from covering such care and by limiting how state funds and state facilities can be used to provide this type of care. Meanwhile, conservative leaders in 6 states hope to implement penalties for parents who facilitate minors' access to gender-affirming medical care.